Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Is my amazing voice audible to everyone? Please let me know. A beautiful evening where we get to share some immense amount of beautiful knowledge thanks to this digital platform where we are sitting at home and connecting in India, US, UK, all over the planet. My name is Dr. Anand. I have done my MBBS from Rajiv Gandhi University Health Sciences. Then I did my MD in the field of pediatrics. Then after that, what happened? After that,
Thanks to
nothing.
this digital platform.
Once again, my voice is coming. Then what happened? Then nothing. I did my SRship from Lady Harding Medical College and NDMC Medical College. Then what happened? Then nothing. I became assistant professor. I was the youngest assistant professor in my college. Then what happened? Then I realized life is beautiful. Then we started teaching long back actually to all the UG and PG and DM and MRCPCH students. Life has been really beautiful. Thank you so much for all your amazing love and support. Today's topic of choice is nothing but growth and development. The subtopic in the last class we had covered craniosynostosis. And most important notice to everyone that in every day in the beginning of the class, I'm going to ask you questions regarding what we spoke in the yesterday's class. So every day in the beginning of the class, I'm gonna take test and I'm gonna ask you some random MCQs which we covered in the previous segment, so that you are connected with me in the previous as well as in the next upcoming segment. Is my beautiful voice coming to everyone? Please let me know. Amazing. Good evening, beautiful people. We have so many amazing students live with us right now. Good evening, Dr. Osama, Shubhangi, Shubham, all the beautiful, amazing people. How's everyone doing? कैसे हैं सब लोग? How's everyone doing? Okay, I just want to know. I hope my voice is audible and visible to everyone. Let me see the comments of everyone. Yes, good evening, Swaraj, Suman, Shubham. Shubham, I'm really good, buddy. How are you, brother? Lalit Yadav, Gudiya, Guddu Shreya, Mansi Panola, Coco, Priya, Sainath, Henna Bird, Shiv, Bhavna Mankar, Lalit Yadav, Sushmita Model, and all the amazing people. Let's start this class. Again, a quick information to all the beautiful people on this planet. We have this amazing class. We had a Delhi batch on 5th of October. 600 students had come. It was amazing. Anyone from Mumbai, 19th October, I'm coming in Mumbai. We have a class there. Also at the same time, we have already made beautiful batches for upcoming next month sessions. 1 day rapid revision online for FMG students, for INICT students, for the NEET students. The link will be in the description of these detailed notification is already there on our WhatsApp group. Let's start this beautiful class. Before starting any amazing segment, we always have a motivating quote. And today's beautiful motivating quote is this: someone else is praying. Someone else is praying for the things which you have taken for granted. This is the strongest quote for this evening, guys. Can you appreciate this beautiful quote? Yes or no? Someone else is praying for the things which you have taken for granted. If I say, we all are lucky that we have our beautiful parents. There are people who takes everything granted. So what? Everyone has parents, but there are some people who don't have a dad or a mom, or who are losing their parents. So we should respect and be humble of what we have in life. So it's a very nice quote which says that someone else is praying for the things which you have taken for granted. So be humble, be nice. What you have in life, be very happy about it. Do you like this quote, Dr. Shubham, Sona, Manoj, Bhavna Mankar, Mansi Panor? It's a very nice quote. I liked it. Someone else is praying for the things which you have taken for granted. So chill and be happy. In the previous class, we spoke about the syndromes associated with craniosynostosis. Dr. Karan Bikram Singh, Shubham, Osama. Perfect, perfect. Yeah. So what are the syndromes? Yeah, exactly. What are the syndromes which are associated with craniosynostosis? Synostosis. It's a quick, kind of a homework which we spoke in the previous class. I hope you guys, agree with me. If you have a Cruzen syndrome, in the Cruzen syndrome, which suture is, which suture is involved in case of Cruzen syndrome? C for Cruzen syndrome, C for coronal suture. Coronal suture ka premature fusion is there in a case of Cruzen syndrome. I hope you understand. Perfect answer. And what about Down syndrome? Do you see craniosynostosis in a case of Down syndrome? Yes, we do see that. For the newcomers, just want to tell you what is craniosynostosis. Premature fusion of the sutures actually is known as craniosynostosis, which gives an abnormal shape of the head. I hope you have attended my previous classes. This is what we discussed. In a case of Down syndrome, coronal suture. coronal suture is involved. Coronal suture का premature fusion होता है, and that basically leads to an abnormal shape of the head that is nothing but known as, any idea? Brachycephaly. Brachycephaly. Can we link and study? In the Cruzen syndrome, also coronal suture craniosynostosis is seen. In Down syndrome, also coronal suture craniosynostosis is seen. Means in both the syndromes, you see small head, nothing but brachycephaly. Brachy means small and cephaly means head. Next question, please. Yes, beautifully told by Dr. Osama Sheikh, one of my favorite junior. We have Imra Fatima also beautifully answering. Amazing. Very good, Bhavna Mankar. The beautiful syndromes apart from the Cruzen and Down, which are associated with craniosynostosis, are Apert syndrome, Cruzen syndrome, Carpenter syndrome, Pfeiffer syndrome. These are the four syndromes associated. And in the previous beautiful class, I remember I showed you the clover leaf shaped skull, which Dr. Osama had told, which was a FGFR1 gene mutation. This is the previous class homework which I'm asking you questions. Okay, so if you're a newcomer, you must watch my previous videos. Every single thing is really very important. Now, this was a neat PG question, guys. Is a Sotos syndrome associated with craniosynostosis? The answer is no. In the case of Sotos syndrome, you do not see craniosynostosis. Means in a case of Sotos syndrome, abnormal shape of the head is not there. The head is fine. Whereas in these syndromes, you see abnormal shape of the head. Dr. Shubham, brother, can you please tell me some two important points on Sotos syndrome? I am a FMG student. I forgot about the Sotos syndrome. Can anyone beautifully put beautiful light on this syndrome known as the Sotos syndrome? The better spelling will be Sotos instead of SO apostrophe S. Previously it was Sotos apostrophe S, but now it is Sotos. Beautiful. Dr. Osama Sheikh is right. Can I write that Soto syndrome is one of the causes for gestational age baby? If you have attended my 50 hours of neonatology classes, in there I have already told about the definition of large for gestational age. I hope you know that. Weight for age. Weight for age more than 90th centile is nothing but a large for gestational age, where we had the small mnemonic of State Bank of India extra account, which their S stands for Sotos syndrome, B for Beckwith-Weidman, I for infant of diabetic mother, E for erythroblastosis fetalis, and C for constitutional State Bank of India extra account. S for Soto syndrome, if again we need to revise, that is the whole criteria of doing this online classes, revision is everything. Soto syndrome, bacha mota hoga, the baby will be heavy or nothing but a large baby, number one. Number two, can I say that this baby will have a natal teeth? Yes or no? Natal teeth. I hope you have done again my previous growth and development classes. One of the causes for natal teeth, we have the mnemonic P's, P-E-E-S, P for Pierre-Robin syndrome, E for Ellis Van Creveld syndrome, E for epidermolysis bullosa, and S for Soto syndrome. If this is something, whatever words I'm saying, if this is something new for you, you must watch my previous videos, because we have done that in depth and detail. So what is the take home message? The beautiful take home message is, Sotos का बच्चा कैसा होगा? शुभम जैसा होगा. शुभम कैसा है? शुभम भैंसा जैसा मोटा है. Shubham is large. Shubham is heavy. One of our very favorite student, Dr. Shubham from Vikas Free from Delhi. If you want his address, I will WhatsApp you. So he is a large baby. He is a heavy baby. When he was born, he had a natal teeth, very important, and kind of a macrocephaly with, I would say, the patient will have a microcephaly and macroglossia. Very importantly, you should know Soto syndrome. Okay, Soto syndrome, I'll tell you one important points. I hope you have seen the picture of Soto syndrome. Do you guys want to see the picture of Soto syndrome? Please let me know. Let me show you a beautiful picture of Sotos, guys. Life is really amazing. 1 second. Sotos. Can we please give a hip hip hooray for Sotos? 1 second. Yes, 1 second, buddy. Now the beautiful picture on this planet. 1 second. Yes. Now, yeah, this is a very classic picture of Soto syndrome, guys. I hope you have seen that. Yeah, that's perfect. So I'll repeat again. What are the beautiful points of Sotos? I'm going to repeat again. Okay, Soto syndrome. The patient will not have a micro. The patient will have a macrocephaly. Number one. Beautiful picture, guys. Can we please say, number one, tell yourself that you are amazing. Tell yourself you have the best biceps on this planet. I can't squeeze my bicep because I have a very mild pain in my elbow. That's why. So the patient will have a macrocephaly. What else? The patient will have, ये F से क्या लिखा है मैंने? What I have written for F, bro? Flushed cheeks. The patient will have flushed cheeks, number two. And also the patient will have kind of a pointed chin. Pointed chin. Okay, I'm revising it again. Okay, please update in your notes. Yes, Osama is right. Karan कह रहा है sorry sir late हो गया. Please photo I will sketch in my notes. Okay, sketch. That's good, bro. You sketch my photo also. Okay, this is really bad. You don't tell me your hidden talents. Can we please share your hidden talents once we study little? I want you guys. Let's talk today about hidden talent. Okay, after half an hour study, we will talk about the hidden talent. I also have one hidden talent. I'll tell you. Okay, yeah. So what are we studying? We are studying that Soto syndrome. Actually, it is not associated with craniosynostosis. Means, what is the meaning of that? The meaning of that is Soto syndrome patient. The shape of the head, you can have a micro or macrocephaly, but it won't be a abnormal head. Are you understanding? It won't be any suture ka premature fusion will not be there in a case of Sotos. Number one, the patient will have a macrocephaly, flushed cheeks, pointed chin. The baby can have a natal teeth. Natal teeth. Natal teeth matlab, what is the meaning of natal teeth, my dear? Yes, Dr. Alfaz, beautiful. Dr. Alfaz, very good. Very good. Yeah. So that's what natal teeth. Uska matlab kya hota hai? Newborn baby having teeth. Can you be, and one more thing, okay, one second. Pointed chin, natal teeth. And yes, number fifth point, the baby will be a large baby, or I would say a heavy baby, or I would say a macrosomic baby. I have so many questions to ask you guys. Let's make pediatrics very easy and most beautiful subject. Can you please tell me, bro, macrocephaly? What is the cutoff for macrocephaly, guys? Dr. Osama Sheikh, can you beautifully answer, buddy? Macrocephaly क्या होता है? Yes, beautiful. Yeah, okay, 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 okay. Perfect. Very nice, very nice. शुभम मार खाएगा मेरे से macrocephaly bro is more than 4 kg, more than 4 kg is macrocephaly. I hope you know that 2.5 to 4 kg is the normal weight of a newborn. PG question number 1. Less than 2.5 kg is a low birth weight low birth weight baby. PG entrance question number 2. What is large baby or a big baby or a macrosomic baby? More than 4 kg will be a macrosomic baby. And of course, this beautiful syndrome, that is nothing but Soto syndrome. The patient will be having a very nice, heavy, big baby. These are the 4-5 amazing, beautiful points, guys. Photographing memory, guys, please, can we say that I have amazing photographing memory? Yes, icons of nursing says, please read my comment. Yes, my dear, just 1 second. I'm gonna read every comment of yours. Just 1 second. So Soto syndrome, last point, macrocephaly, flushed cheeks, pointed chin, natal teeth, macrosomic baby. These are the beautiful points of Soto's syndrome. And do you see craniosynostosis in a case of Sotos? The answer is no, we don't see that. Has everyone beautifully understood? जुकाम लग गया मेरे को. Once again. Icons of Nursing has a beautiful comment. She says, sir, I want to thanks for making the pediatrics easy for us. Just because of you, I started loving pediatrics. I got AIMS Bhubaneswar with pediatric specialty in MSc Nursing. Thank you for rocking our life with peds. Thank you so much, Dr. Icons of Nursing. That's very, very, very kind of you. That's very beautiful. And also, Dr. Shiv has some beautiful comment to say. He says that I am not going to continue knocking that old door that doesn't open for me. Very strong. Good, bro. He says that I am not going to continue knocking that old door that doesn't open for me. I'm going to create my own door and walk through that. Bang on. 10 out of 10, bro. Proud of you. Proud of you, Shiv. Proud of you. Can we please take some good motivation, guys, from Dr. Shiv? He says, I'm not going to continue knocking that old door that doesn't open for me. I'm going to create my own door and walk through that. भगवान सबको तुम्हारी ऐसी अक्ल दे, बहुत अच्छी बात है. May God give you such beautiful knowledge and good vibes the way you are sharing with us. Can we continue this beautiful class? Yes, please. Okay. One more $1 million question I would like to share with you. Yeah, this also is a very beautiful slide, guys. Yesterday, some student was asking me that, sir, anterior fontanelle, you told, see, roughly when does anterior fontanelle closes? Actually, it closes by 8 to 18 months. Okay, 8 to 18 months, and maximum you can go till 24 months. Actually, many books says many answers actually, but this is our best answer. Anterior fontanelle is the last fontanelle to close. That is the first exam question. Closes by 8 to 18 months, maximum by 24 months. Anterior fontanelle closes, number one. When does posterior fontanelle closes? Again, many books have given many things, my dear friends, but this much you remember that around 2 months, around 1 to 2 months, posterior fontanelle closes by 1 to 2 months. Sphenoid fontanelle, which is a pair, it closes by 6 months, and mastoid fontanelle, it closes by 6 to 18 months. 6 to 18 months. Okay, but anterior fontanelle, my dear, it will be the last one. It will be the last one to close. And anterior fontanelle you can feel, posterior fontanelle you can feel, but can you feel sphenoid and mastoid fontanelle? No, bro, you can't feel that. Okay, perfect, perfect, perfect. करण कह रहा है मेरी भी सुन लो सर। हाँ बता क्या चाहिए तेरे को, तू इधर आ मेरे पास, क्या चाहिए बता तेरे को। Okay, huh. So someone is asking what is natal teeth? That's beautiful, bro. Natal teeth, my dear, is nothing but newborn baby having teeth. Can you please tell me one beautiful answer that what you called what is the which is the first temporary teeth to appear in a baby? I am saying natal teeth. This. What is who is this? Can you please comment what is this picture showing, guys? This is a very beautiful AIMS question. Identify the picture seen in the image and give your best, beautiful, amazing, mind-blowing diagnosis. I made the class so positive. Best, beautiful, mind-blowing diagnosis. That's cute. So, my dear friend, this is the beautiful natal teeth. One of my patient who comes to my PP. PP मतलब private practice. उसमें this patient had come a newborn baby with natal teeth. Who is this baby? Can we please have a what you called a small guess? Yes, this is Osama. This is Osama Sheikh, one of my favorite junior. This is his what you called childhood picture. Very beautiful picture. Can we please appreciate this picture? Yes or no? Yes. Alfaz says this is a cute baby. That's my dear. Yeah. Dr. Zainab is right. Lalit Yadav is right. Let's have some 5 bang on questions. Question number 1. Which is the first temporary teeth? Which is the first temporary teeth to appear in a baby? डॉक्टर मेरे बेबी का पहला टेम्पररी टीथ कब आएगा? डॉक्टर when will be my baby's first milk teeth or first temporary teeth will come? Madam, it will be the lower central incisors. Lower central incisor. Doctor, when it will come? 6 to 7 months. 6 to 7 months. The first temporary teeth to appear in a baby is a lower central incisor, which comes by 6 to 7 months. Which is the first permanent teeth to appear in a baby? Can we beautifully answer in the comment section, please? डॉक्टर मेरे बेबी का पक्के वाला दांत कब आएगा? ओसामा तुम्हारा दांत कब आया था? ओसामा का थोड़ा सा लेट आया था. So the first temporary teeth to appear in a baby is the first molar, which comes by 6 to 7 years. 6 to 7 years. Please, this is beautiful questions, guys. Please, can we have good vibes? Can we have good vibes? धीरे धीरे बोल कोई सुनना ले कोई सुनना ले. The first temporary teeth to appear in a baby is the lower central incisor, which comes by 6 to 7 months. The first permanent teeth to appear in a baby is the M1, that is the first molar, which comes by 6 to 7 years. Which is the last permanent teeth to appear in a baby? Dr. Shubham from Vikaspuri. Yes, the last permanent teeth to appear in a baby is the third molar, which comes after 18 years of life. Of some book says 18 से 21 साल पे आता है. Some book says 18 to 21 years of life, you get the last permanent teeth. Which is the last temporary teeth to appear in a baby? Can you beautifully answer in the comment section? The last temporary teeth to appear in a baby is the second molar. Second molar is the last temporary teeth, which comes roughly by 1.5 year of life, which comes by around 1.5 year of life. I'm going to repeat again this beautiful question, and then I'm going to ask you, and if you answer wrong, then you see what will I do. PG entrance question number 1. Which is the first temporary teeth to appear in a baby? The answer is lower central incisors, which comes by 6 to 7 months. The first permanent teeth to appear in a baby is the first molar, which comes by 6 to 7 years. How will I remember, sir? Bro, it's very easy. 6 to 7 months. 6 to 7 years. Finish. Which is the last permanent teeth to appear in a baby? Sir, third molar comes by 18 to 21 years. Which is the last temporary teeth to appear in a baby? That is the second molar, which comes by 1.5 year. Okay. And one beautiful question. Ye kya hai cutie pie? The cutie pie is having this natal teeth. Chota baby, newborn baby having teeth. Yes, creativity next level. The idea is creativity next level. It says, is it helpful for FMG? Dear, please solve last 3-year question papers of FMG. These questions have come multiple times. These classes are important for NEET, INI, CET and FMG and AIMS. All question papers are same. Hello. It's all questions are same, okay? If you have seen the recent FMG paper, another level the paper has come. Better than NEET paper level has come. So you must religiously follow the lectures. Yeah, okay. जुकाम हो गया मुझे जुकाम हो गया Has everyone understood? Yes or yes, please let me know. Can we continue this class, guys, or what do you want to know? जुकाम हो गया रुमाल की तरह रुमाल किथे है हाँ जी Ritu gave a heart. Thank you, Dr. Ritu Satna. Ladit Yadav, okay. Swaraj Suman, beautiful. Amazing people. Madhuri, creativity next level. Grace Sharon, Madhuri Gupta, Manoj. Okay, okay. Perfect. किसने दिल भी दिया है दिल तो दिया है Okay, गुडू शुभम okay. Yes, Dr. Shubham says, yes, exactly. This time the paper was tough, though for FMG even. Yes, buddy, all the levels are now same, okay? Now, I suggest everyone that these classes are for FMG, NEET, INACT and AIMS. ऐसा कुछ नहीं है. There is nothing that it's not for FMG, it is for NEET. No, hello. Remember, okay, please. Can we continue, yes or no? Creativity next level says, lovely. Cute. Okay. जुकाम हो गया शुभम जुकाम हो गया मेरे को ओके 1 second where is the slide 1 second let me check this part is done this अच्छा हाँ ये बहुत important हुआ 1 second bro we had a question okay 1 second let's continue further this beautiful class again a quick motivating quote which says prepare and prevent rather than repair and prevent rather than repair and repent. Prepare for what? Prepare that people will leave you. Prepare that anything can happen in your life. Prepare that the worst will happen in your life. Prepare for everything, okay? Be prepared. Be alone, be nice, enjoy your company and chilled out. Prepare and prevent rather than falling in love and then repairing yourself and then repent. Are you understanding? Prepare and prevent rather than repair and then repenting. Okay, can we continue this class? Yeah, this part is done. Yeah, a beautiful question, guys, a beautiful question. This is the exam question. A newborn baby having open posterior fontanelle, like not a newborn, I would say like of a 4-month-old baby by mistake, because posterior fontanelle will be obviously open in a newborn baby. 4-month-old baby with an open posterior fontanelle and a large tongue with a rough dry skin. This is the FMG 2021 question, guys. Can you please beautifully tell me what is the answer for this question? Yes. शुभम बड़ा गंदा है शुभम कह रहा है ए वन ब्रांडी विल हेल्प दैट्स नाइस आई थॉट बीरा वाइट विल हेल्प okay Divya Shri says this is my first live class sir happy you are awesome thank you Divya Shri you are beautiful you are amazing Karan says there is a saying that you better bleed in peace than you bleed in war you better bleed in peace than you bleed in war oh, high five the beautiful answer yes beautifully told by amazing people like Priya Gupta has the best answer Mansi Panula Bhavna Mankar Harris Ahmed Priya Gupta Grace Sharon beautiful so congenital hypothyroidism should always be ruled out if the patient has a open posterior fontanelle large tongue and a rough dry skin and one more thing guys in the end of the class I'm going to ask you 5 random questions Shubham ये तेरी duty है Shubham it is your duty to remind me in the end of the 20 minutes like 9:20 p.m. you need to remind me sir please ask 5 random questions from the previous classes and like a random question of pediatrics and today I'm gonna give you rupees 200 Paytm straight away and every time I think Dr. Priya Gupta is winning too much Shubham थोड़ा तमीज में आगे आ जाओ बेटा देखो तुम्हारी बहन बहन तो नहीं, तुम्हारी फ्रेंड देखो नंबर ला रही है अच्छे, ठीक है। सो आई रिकमेंड एवरीवन टू आंसर इन द एंड ऑफ द क्लास, वी गोना हैव अ रैपिड क्विज, 5 questions I'm gonna ask you, could be image based questions, and that's what, rupees 200 paytm every time Priya is winning. Let's say today, who wins. Priya, I'm sorry, I put the competition little higher now on you. Okay, which sinus is absent in a newborn? Such a beautiful question, guys. Can you please answer in the comment section, which sinus is absent in newborn? Options are: number one, frontal sinus; ethmoidal sinus; sphenoid sinus; maxillary sinus. Can you beautifully answer in the comment section, yes or no? Jai Hind, that's right. Perfect. Suman says बहन. अच्छा, सुमन खुद लड़की करी, बहन बहन होगी तुम्हारी, अच्छा. Perfect. The beautiful answer. Which sinus is absent in a newborn? My dear friends, could you answer in the comment section, please? Beautiful, 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 beautiful people answering beautiful. Mansi Panola says ethmoidal sinus. Such a beautiful answer. Such a beautiful answer. Achha, now Mansi Panola has told. So every single person will copy paste Mansi Panola's answer and then put a comment. Okay. शुभम तेरे को घर पे आके मारूंगा. शुभम ने कहा है ethmoidal sinus. बेटा उधर जाओ, डर खत्म हो गया तेरा, मुझे लग रहा है डर मेरा खत्म हो चुका है तेरे ऊपर. शुभम इधर 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 इधर, गलत, रॉन्ग आंसर. चप्पल कहाँ है मेरी? ऑस्कर चप्पल आई हो मेरी एक बार. एथमोइडल, कहाँ से पढ़ा तुमने? फ्रॉम वेयर हैव यू रेड एथमोइडल साइनस? डैडी ने नहीं बताया, डैडी ने तो बताया नहीं एथमोइडल साइनस. कहाँ से पढ़ के आया तू? द ब्यूटीफुल आंसर ऑन दिस क्वेश्चन इज फ्रंटल साइनस. फ्रंटल साइनस. Frontal sinus is absent in a newborn. It begins to develop by 7 to 8 years of life. Bro, please remember. Dr. Shubham, मार खाने से पहले could you please remember this question? Thank you. तुम्हारे सारे सारे भाई और बहनों ने एथमोइडल जो है दिया है. ब्यूटीफुल. अच्छा, और सुमन ने तो निमोनिक भी बना दिया है. ई फॉर एथमोइडल, ई फॉर एलिमिनेटेड. वेरी क्यूट. सुमन सुधर जाओ तुम, आई समझ. So frontal sinus, I recommend everyone to change the answer. The frontal sinus, yeah. Oh, Karan says frontal है शायद. अच्छा, अच्छा है तो पंडित है यहाँ पे. frontal है शायद. बेटे मार खा लोगे मुझसे तुम. The frontal sinus is absent in a newborn. Sir, कब तक sir? When does it develop? My dear, it develops by 7 to 8 years of life. Please remember that. Okay. A beautiful slide. Can we please appreciate? This is the frontal, bro. This is the frontal sinus. This is the ethmoidal sinus. थोड़ा सा इस तरफ होता है. We have the this side. We have the maxillary sinus. Has anyone understood? Mansi Panola, Karan Vikram Singh. Okay, Suman, Sona. Okay, Manoj, Guddu, Shersia. Okay, frontal. Yes, my dear. Please remember. Which is the fontanelle is the last to close? Can you recent question January 2018? Can you beautifully answer in this comment section? और बेटे अगर ये आंसर गलत किया, if this answer someone give wrong, you see what will I do then? Okay, I hope you know that the beautiful answer on this planet is anterior fontanelle. Anterior fontanelle is diamond shape. In the milestone, when can a baby make a diamond? The beautiful answer is a 7-year-old. When can a baby? So 7-year-old baby can make a diamond. It's a neat PG question. Already it has come. When can a baby make a straight line? Can we ask random questions? अच्छा गलत आंसर किसने दिया? मैं गलत देख लूँ. Sharma Neha says posterior fontanelle is the last one to close. शर्मा नेहा सुधर जाओ, ठीक है. इतनी वार्निंग दे सकता हूँ मैं, ठीक है. अच्छा हाँ ओके. अच्छा, नाउ सुमन केम विद अनदर निमोनिक. शी सेज एफ फॉर फ्री. F for free. Newborn is free, so frontal sinus is free. Is got absent in a newborn. Cute mnemonic. Good. मैं impress हो गया, मैं impress हो गया. हो खुश, मुझे impress करना था, मैं हो गया impress, ठीक है. So yeah, this is the right answer. Perfect. Okay. Karan. Okay, great. Perfect. When can a baby make a straight line, guys? Karan says the baby can make a straight line by 3 years. Karan, तुम्हारे बचपन की बात नहीं हो रही यहाँ पे, नॉर्मल बचपन की बात हो रही है. अब straight line, a straight line has how many ends? Can we please tell me in the comment section? A straight line has how many ends? So 1 and 2. Straight line has 2 ends. So a 2-year-old can make a straight line. Let's see, like imagine I'm a 8th class student, I'm teaching to a 6th class student. It's like this. Okay, let's study that way. Okay baby, please remember straight line has how many ends? 1 end. This is the second end. Yes, 2 ends. So a 2-year-old can make a straight line. What about the plus or a cross? Can you beautifully answer in the comment section, please? Beautiful. Amazing. A plus has how many ends? 1, 2, 3, 4. Yes, a 4-year-old can make a plus. A 4-year-old can make a plus. A straight line, अच्छा straight line भी दो प्रकार की होती है. There are two. Yes, Dr. Osama beautifully has told the right answer. There are two type of straight lines. One is vertical straight line, and then we have the horizontal straight line. Can you beautifully answer in the comment section, please? Which one comes first? Should a baby make a vertical line first, or should a baby make a horizontal line first? You have 7 seconds to answer in the comment section. Gudush Shri, your surname is difficult. Gudush Shersia. Am I right? Shersia. That's perfect. We have Joyesh. Perfect. Karan Bikram Singh. 4 years, sir. Yes, buddy. So there are two type of straight lines. Please remember. Chota baby, small baby. When the Karan was small, let me write his name. Karan Bikram Singh. Okay. When Karan Bikram Singh was small, then in the beginning he started making vertical lines. बच्चा सीधी line पहले draw करता है. It comes by 18 months. By 18 months of life, a baby make a vertical line. Okay, and when the baby becomes little bada, a little bigger, then the baby makes a horizontal line. This is a neat PG question. Please remember, a baby can make a vertical line by 18 months, horizontal line by 24 months, plus by 4 years. Has everyone understood this much? Yes or yes, yes. Can we continue? Mansi Panola is right. Yes, my dear, there are a lot of drawing skills, but once we come on the milestones, then I'm going to comment on that. It was just a random this one. Please put a thumbs up or like this video. Can we continue, or do you want to recap? You have 7 seconds to answer. जुकाम आ गया मुझे रुमाल देना यार, मुझे जुकाम हो गया, वो रुमाल रखा होगा. Dr. Devil says, I used to make horizontal line first. That's cute. I think you are unique. You are amazingly unique. Very good. Very nice. Okay. Yes. Please close your ears. I'm going to blow my nose. I recommend everyone not to sudko, no, don't do like this and we get headache. So blow your nose. Taki besti ho ya na ho, doesn't matter. Next question, please. What is this part is done? Done. The beautiful craniosynostosis is done. Dr. Karan Bikram Singh, can you beautifully answer in the comment section, which is the most commonest type of craniosynostosis? The most commonest type of craniosynostosis is which one? Yes, very beautiful answer. Dolichocephaly. Dolichocephaly. I have two random questions. Dolichocephaly is also known as dash, and which sutures craniosynostosis is there in dolichocephaly? Yes, beautiful answer. That's perfect. Perfect. Amazing. Dolichocephaly is also known as scaphocephaly. That is the right answer. And also, which suture craniosynostosis is there in the dolichocephaly? The beautiful answer is sagittal suture. Sagittal suture. That's perfect. Amazing. Grace Sharon. अच्छा Grace Sharon. She wrote something. Then they deleted the message डर के मारे कि भी गाली ना पड़ जाए. Good. Impressive. Nice. Okay, that's right. Osama is right. Dr. Strange. Dr. Strange says, sir, your teaching is the best. Thank you, bro. Thank you. God bless you. Be happy. Life is beautiful. Life is just bloody one. Just enjoy the show. Enjoy the show. You must enjoy the show. I'm telling you. Frankly, I'm telling you. You know, then later in life, you will say, oh, I wish I would have enjoyed my school time. This part is done. Can we continue, please? Perfect. This part is done. Yeah. Anterior fontanelle. I think we have done that. I'm not sure about it. Anterior fontanelle is located between which two bones? Can you beautifully answer in the comment section? A, B, C, D. Beautiful. Fast. Dr. Grace Sharon, Karan Bikram Singh. Anterior fontanelle is located between which two bones? Such a beautiful question. Can you please answer in the comment section? ठीक है. ओके करण सेज मैं पहले कॉर्नर लिखने वाला था फिर डर के मारे मैंने नहीं लिखा. गुड आई अप्रिशिएट योर डर. Okay, perfect. A, B, C, D. Can you beautifully answer in the comment section, please? A, B, C, D. Beautiful, amazing answer by Pandey and Devil and Priya Gupta. I hope you know that. This is my beautiful skull. पता नहीं कल वाली क्लास में करा था या नहीं करा था, मुझे याद नहीं है dear. So this is the frontal suture. This is the parietal suture. The beautiful answer is that anterior fontanelle is between the frontal and the parietal suture. This is a very basic question. बेइज्जती करा के नहीं आनी अपनी. Please अच्छा लिख के आना. Don't do wrong things in the paper. Write the right thing, please. It will be good. This is done. Okay, premature closure. Please, premature closure of the frontal, sphenofrontal and frontoethmoidal suture is seen in which case? Maharashtra PG CET question. Yes, perfect. Okay, शुभम कह रहा है करा था कल. अच्छा करा था तो ठीक है ब्रो, मैं आगे बढ़ जाता हूँ. Then I should move further in life. The beautiful answer is amazing. I hope you know that when my multiple sutures are kind of prematurely fusing together, when multiple sutures are fusing together, I will have a shape of the head known as tower head. Tower head is nothing but known as turricephaly. Turricephaly. Mansi Panola says D is the best answer. Mansi Panola, सुधर जाओ. वीडियो कॉल कर रखी है ना हम सबने जूम पे, तुम्हारी शक्ल देखी है मैंने, मुझे याद है तुम्हारा शक्ल. ट्राइगोनोसिफेलिक किस वजह से होता है? वेयर डू यू सी ट्राइगोनोसिफेलिक? कैन यू आंसर इन द कमेंट सेक्शन? Metopic suture, my dear. If there is a premature fusion of the metopic suture, you will have a beautiful trigonocephaly. Turricephaly or oxycephaly is seen when the multiple sutures craniosynostosis is there. Amazing. Yes, Dr. Karan Bikram Singh, तेरे सर जैसा tower head. That's cute answer. Perfect. अच्छा शुभम, हमने ये कल करा था या नहीं करा था, मुझे याद नहीं है. Did we cover this in the yesterday's class? Please let me know yes or no. Perfect. Coco is right. Cute name, Coco. Cute. Okay. Osama Sheikh, perfect. Karan Bikram Singh, Shubham, perfect. Ajay, perfect. Did we do this syndrome yesterday? Yes or no? शुभम कह रहा नहीं किया. ठीक है. Okay. Osama. Huh. Okay, let's move further. This is a very beautiful syndrome, guys. What do you think? Let me show you one more picture. This, what can we appreciate? If this is today is the NEET PG paper. Imagine right now, this is the NEET PG paper. And the question number 1 for the NEET PG paper is, identify the syndrome and tell at least 2 important points in this syndrome. Such a beautiful question, guys. Please. हाँ. मानसी पनोला से सॉरी सर, आज बहुत गलती हो रही है. तुम च्यवनप्राश खाओ, तुम्हारे दिमाग में कमजोरी है. तुम च्यवनप्राश. I recommend Dr. Mansi Panola, you should have 10 almonds per day. I go to gym, I have 20. So, and 1 spoon of honey also will be nice. And च्यवनप्राश is good. मैं वो माधुरी दीक्षित वाला खाता हूँ, डाबर वाला आता है. That's nice. रामदेव वाला I have tried, but that माधुरी दीक्षित वाला is fair enough. Yeah, that's perfect. Okay, this is not Pfeiffer, Shubham. Okay, ये Pfeiffer नहीं है. ओसामा मार खा लेगा. Osama, this is not Pfeiffer syndrome, my dear buddy. Pfeiffer we have shown, clover leaf shaped skull was Pfeiffer. Can we say that this baby has a low set ears? Yes or yes. Please let me know. Can we say that this baby has a low set ears? Can I say that this baby has kind of a proptosis, kind of a exophthalmos, kind of a proptosis, kind of a bulging eyeballs? Yes or yes. परफेक्ट. शुभम, हाँ वो उसकी ऐड करती है इसलिए. परफेक्ट. डाउन सिंड्रोम, आई एम सॉरी माय डियर, दिस इज नॉट डाउन सिंड्रोम. ओके, ये द ब्यूटीफुल लो सेट ईयर्स. व्हाट इज, ओके, एग्जामिनर विल जज यू इफ यू डोंट आंसर करेक्टली. व्हाट इज लो सेट ईयर्स? एनी आइडिया माय डियर फ्रेंड्स? व्हाट इज लो, हाउ डू यू डिफाइन लो सेट ईयर्स? इतने सारे आंसर्स. डॉक्टर के सेज हैप्पी पपेट. हर लाइन का एक अलग सिंड्रोम है. ओके फाइन. So what is low set ears? Sir, if I draw a straight line, from the medial canthus to the lateral canthus, a straight line like this, normally my 1/3 of the ear lobule should be above to that straight line. I'll repeat again. If I beautifully, amazingly draw a straight line from the medial canthus to the lateral canthus like that, if normally my ear ka 1/3 should be up and the 2/3 should be down, this is normal. If it is below, then this is known as low set ears. Low set ears is like a broad term. It's like a random finding, could be seen in down. All the syndromic babies have something known as coarse faces. Coarse faces ka matlab means, the meaning of the coarse faces is kind of a abnormal, strange faces. Could be a depressed nasal bridge, low set ears, triangular face, could be anything. So low set ear is a broader term seen in multiple syndromes. Okay, low set ears is not a pathognomic finding for any syndrome, but it is a finding in a coarse faces में आप बोल सकते हो. You can say it's a low set ears. And proptosis. Perfect. Okay, Dr. K, a beautiful member to our family of pediatrics. Dr. K, I don't know, he's a new person. He says happy puppet. Can you beautifully answer in this comment section, this beautiful amazing class, where do you see happy puppet? There's only one answer. ठीक है, मार खाने से पहले कोई अच्छा आंसर देना चाहेगा? Anyone? Okay. Yes, Dr. Grace has already told a beautiful answer. Angel man syndrome. Angel, see, we have to link and study, right? That is the thought process of this combined live classes, where we discuss. You give your answers, I tell them ki baba, this one is seen in this and this one is seen in this. Okay, so beautiful answer, that's perfectly right. Okay, Ajay says Rell syndrome. ये तो मैंने भी नहीं सुना. Rell. Okay, the beautiful answer, yes, Dr. Devil is right, Shubham is right, Dr. K is right, Mansi Panola is right. Where do you see happy happy puppet? The answer is Angelman syndrome. Can you please tell me in Angelman syndrome is an example of? Angelman syndrome is an example of uniparental disomy. I have this very bad habit of linking and study. Well, one extra point and I'm like bang on. I know everything of that other thing. Uniparental disomy examples are Angelman and Prader-Willi. Angel is the mother. So in a case of Angelman syndrome, maternal gene is deleted. And then other one is which one? The other one is Prader-Willi syndrome. Prader-Willi syndrome, paternal gene is deleted. Angelman syndrome, angel is the mother, maternal gene is deleted. Angelman and Prader-Willi both are the examples of uniparental disomy. Uniparental means from the same parent. Normally, when I was born, one copy I had of my father, one copy I had of my mother. But in the case of uniparental means from the same parent, disomy means the copy of the genes, instead of one from the father and one from the mother, I have either both of the copies from the father, both the copies of the gene from the mother. In a case of Angelman syndrome, angel is the mother, so maternal gene is deleted. And the patient will be like a happy puppet, happy baby, and we have a long mnemonic and all that. I'll not go there. That's a separate topic. And in Prader-Willi syndrome, paternal gene is deleted. The patient will have he will eat a lot, voracious appetite, what you call obesity, micro penis, intellectual disability, and all that. Bang on. Has everyone understood? Yes or no? Please let me know. What about this syndrome, sir? ये कौन सा है? ये कौन सा है? One more photo. Beautiful. Can we appreciate, can we respect our patients? Your patients are your real teachers. Books, theoretical knowledge is beautiful, but once you see a real patient, when I was working in Lady Harding Medical College, ऐसे ऐसे घूमते fragile legs तो ऐसे घूमता था गलियों में. Fragile legs used to roam like this OPD. When I entered in Lady Harding, no, this Kalavadi Sharan Hospital, I was doing this OPDs. Angel man is roaming like that. Soto Syndrome bacha is playing. Down to ऐसे ही नीचे, but down to is sitting here only like that. I was like, oh my god, this is fragile legs large. And then I was like, I was getting this deja vu, some like a beautiful 360-degree angle of knowledge. Oh, fragile legs. This is fragile legs. You are guys, you know this fragile legs. And then SR is saying, sir, fragile legs to every day we see, sir. I was like, are you sure you see fragile leg syndrome every day? That's insanely crazy, because I was so excited to see a fragile leg syndrome. I was like, yeah, fragile leg. Okay, yeah, I remember large ears. Okay, what else? Yeah, what you call large kind of head, large testes. Okay, mental retardation, intellectual disability, this and that. The triple nucleotide gene deletion defect, yeah, that is there. And what is not a large? Nose is not large. Like that, your brother used to finish the whole pediatrics only. It was amazing. Now this is beautiful syndrome, guys. Yes, this beautiful syndrome is nothing but Cruzen syndrome. This beautiful syndrome is nothing but Cruzen syndrome. How do you know, sir? Bro, I'll tell you, it's very easy. Number one, can I say, okay, from where should I start? Okay, start from nose. First beautiful answer, can I say the patient will have a beaked nose? Number one. Number two, the maxilla is little kind of gone down. I would say maxillary hypoplasia. Please, photographic memory, my dear, you all are like like brothers and sisters to me. So like I want you to appreciate knowledge and get good knowledge and enhance your beautiful, amazing brains. The more beautiful, complex instructions you follow, the more amazing your brain is. That's scientifically proven. Okay, this beautiful patient has a beaked nose. The patient has a maxillary hypoplasia, and the mandible is thoda sa aage. The mandible is little protruding out. When the mandible is beautifully protruding out, what do you say it, bro? Buddy, you say it mandibular prognathism. Mandibular prognathism. Are you understanding? Yes or no? 250 gram दिमाग में घुस रही है knowledge? Yes or no? In your 250-gram brains, is it going inside? Great. Mandibular prognathism means the mandible is protruding out. Okay. And if the mandible is kind of a backwards, I can say micrognathia. Micrognathia, right? Can you beautifully tell me one syndrome associated with micrognathia? One syndrome associated with mandibular prognathism is Cruzen syndrome, and one syndrome associated with micrognathia. Micrognathia, maar khane se pehle, any idea? Dr. Saab, we have a nice idea. His name is Dr. Saab. Yes, buddy, this is all picture out of Cruzen. First photo, Cruzen syndrome. Second photo, Cruzen syndrome. Third photo, Cruzen syndrome. Okay. Hanji. Hanji. Okay. Madhuri Gupta. Okay. Buddy, which syndrome is associated with microgynecia? Yes or no? Fetal alcohol. Fetal alcohol. Okay. Yes. Orion. और जुकाम का बड़ा मरना है भाई गॉड. थक गया मैं. हाँ. Priya again. Priya Gupta is online. Priya Gupta is online. I'm scared that today also she'll win 200 Paytm. The beautiful syndrome associated with क्या बोलते हैं उसको microgynecia is one beautiful syndrome that is nothing but Pierre-Robin syndrome. Pierre-Robin syndrome is important. Remember, difficult bag and mask ventilation. It will be difficult to intubate and bag and mask in this child in a case of Pierre-Robin. Why? Because the mandible is so chota, so small that I in the bag and mask I will not be able to make a seal properly. Kind of a thing. Number one, and it's difficult to intubate the child also. In this beautiful picture of Cruzen syndrome, the patient will have a beaked nose. The patient will have one more beautiful point, guys. What do you call it when there is an increase in the distance of two eyes? Such a beautiful knowledge. मुझे बड़ा मजा आता है knowledge share करने में. Can you answer in the comment section when there is increase in the size between the two eyes? What do you call it? Can you beautifully answer? Yes sir, yes, yes. Please let me know. Hello, hello. Yeah, okay. Anyone? हाँ जी, क्या है? Okay. Hypertelorism. Will you remember this for me? Yes or no? Hypertelorism. Hanji, that's very right. When there is increased distance between the two eyes, that is hypertelorism. Priya Gupta, again you are right. ठीक है. शुभम शुभम इतने प्यार से बोलता है ना, सर चार्ज लगा लो. तो मैं छींक मारूंगा, शुभम कहेगा सर वो सर सिरप पी लो, सर गर्म पानी तो पियो. ऐसे मनीष भी ऐसे करता है, सर यू शुड टेक वाटर, यू आर गेटिंग ब्रेथलेस. That reminds me of my favorite ma'am, Dr. Nidhi DM, neonatology from MAMC, Maulana Azad Medical College. And she had a professor. I told you the story, no, Shubham? She had a professor. His name was Dr. Ramji. That also I don't know him, but he's a very very famous personality in pediatrics in Delhi, in India, it seems. So she's like, Dr. Ramji used to shout at us so much. Neonatology morning rounds were insanely, horribly crazy and very charismatic, as well as full shouting and full bang on shouting. तुम्हें ये नहीं आता, तुम्हें वो नहीं आता. You don't know this, you don't know that. And then ma'am used to say, sir, you are shouting too much. Your BP will increase. Sir, should I get you a juice? You can shout at me, no problem. But should I get you a juice? Sir, your BP बढ़ जाएगा आपका. He's like, don't care of my BP. You are not this and that. Ma'am used to say that. बड़ा मजा आता है सुनने में. It was very fun to understand. Yeah. Yes, beautiful picture. What is this? Who is this? What is this? पहले मैं ऐसा दिखता था, अब मैं ऐसा दिखता हूँ. Before I used to look like this, but today I look like this. Now, can we please remember CCC? Because in a case of Cruzen syndrome, the patient will have a craniofacial malformation. I told dear, beaked nose, maxillary hypoplasia, and mandibular prognathism with hypertelorism. Such a beautiful picture. It took me a lot of time to collect this picture. Please appreciate this picture. This is Cruzen syndrome. Every syndrome we must appreciate some specific finding. Cruzen syndrome, C for Cruzen, C for craniofacial malformation. And what is this third C of the Cruzen? Cosmetic correction, guys. Please remember. The patient has to get a cosmetic correction done. Can we see that? This is a very beautiful picture. So every syndrome you need to have a specific point. If I say single palmar crease, what do you think? I should think of Down syndrome and other syndromes also, but I definitely should think. If I say hemihypertrophy of limbs, what should I think of? Beckwith-Whiteman syndrome. If I say, okay, what should I say? If I say natal teeth, then Soto Syndrome. Large baby, Soto Syndrome, like that. Perfect. ओसामा से पीडीए पीसीएम निधि मैम 15 mg. क्या लिखा है ओसामा, मुझे कुछ समझ नहीं आया. Yeah, so perfect answer, that's right. So in the case of Cruzen syndrome, can we finish this class by this last syndrome known as Cruzen syndrome? Number one, it is autosomal dominant inheritance, FGFR2 gene mutation. I hope you know that we have done this multiple times. FGFR3 gene mutation is seen in achondroplasia. We have beautifully done that. Where do you see FGFR1 gene mutation? FGFR1 gene mutation we have done that. We see in a case of Pfeiffer syndrome. The quiz is about to start in 1 minute. It's already 9:30 p.m. 5 questions I'm going to ask you. Rupees 200 Paytm I will do. Whosoever wins the best answers. Okay. And it's a healthy talk show, so don't take it too hard if you don't win. Okay, last questions. Konsa dear, Grace Sharon, which last question dear you're saying? So FGFR1 gene mutation is seen in Pfeiffer, FGFR2 gene mutation seen in Cruzen, FGFR3 gene mutation is seen in achondroplasia. Number one. Number two, which craniosynostosis you see in a case of Cruzen? So remember again, C, C, C. Cruzen syndrome, the craniosynostosis you see is the coronal suture ka premature fusion, nothing but leading to brachycephaly. Okay, and C for Cruzen, C for craniofacial malformation, C for cosmetic correction. So C, 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 mnemonic finish. And autosomal dominant inheritance. Can you beautifully tell me any three more condition with autosomal dominant inheritance? Anyone? Quick one, quick one, quick one. Karan, yeah, bro. नहीं try तो कर. So yeah. So autosomal dominant inheritance. What are the other examples? मुझे एक mnemonic याद आ गया. MAT और match बोल दो. Match. M for Marfan syndrome. A for achondroplasia. T for Treacher Collin syndrome. Okay, and C for Cruzen syndrome. खत्म कहानी, खत्म कहानी, खत्म कहानी, खत्म कहानी. Crido chart, you sure? Crido chart is autosomal dominant. I need to check that, bro. Okay, perfect. So this match is one quick mnemonic. Actually, एक और mnemonic भी है dominant बोल के एक there's a mnemonic by name dominant, and we have a lot of syndromes there. But I remember this one is for quite easy match. So Marfan syndrome, achondroplasia, Treacher-Collins syndrome, and Cruzen syndrome. H is nothing. H just like that I have put H. So that is match for the autosomal dominant inheritance. And also one more mnemonic here only we need to know about this. The beginning three, the MAT basically. In a case of acute rheumatic fever, when the patient get a acute rheumatic fever followed by a rheumatic heart disease, NEET PG and FMG question, which is the first valve involved in a case of rheumatic heart disease. It is the mitral valve, followed by the aortic valve, and followed by the tricuspid valve. So mitral followed by aortic followed by the tricuspid valve, that you should know. Yeah, okay. Dr. Saab says, when can we connect? When can we connect? Connect. Okay, perfect. Yeah, that's right. Dr. Strange is right. Osteogenesis imperfecta, right answer. Perfect. Done. The patient of Cruzen will have a beaked nose. The patient, I told you, maxillary hypoplasia. Exophthalmos, I have told you. Hypertelorism, beautifully I have told you. Brachydactyly, extra point you should know, the patient will have brachydactyly. The patient will have mandibular prognathism. The patient will have dental problem, hearing loss, and hydrocephalus. Hearing loss as well as hydrocephalus. Hydrocephalus was the exam question actually. Do you see hydrocephalus in a case of this one? The patient can have hydrocephalus in general. Okay, yeah. So and don't get confused. Okay, sir, here you have told that the coronal suture is involved, and coronal suture involving is nothing but a small head, brachycephaly. But here you are saying the patient can have hydrocephalus. So both patient can have. Patient can have an abnormal shape of the head, brachycephaly, and also if the patient is not having brachycephaly, the patient can have hydrocephalus. Are you understanding? Like it's a variety, very term. It's not that every Cruzen will have a coronal suture. No, it can be plus and minus like that. Low set tears done. And yeah, last question, which is the most common craniosynostosis in the whole, like which is the most common craniosynostosis syndrome? The answer is Cruzen syndrome. Cruzen syndrome. Done. That finishes this class, guys. Has everyone understood? Yes or yes? Please let me know. Put a thumbs up, bro. Did you understand? Yes or yes? Let's have a test now. I'm gonna ask you 5 questions. Whosoever will be writing the answer first in my comment according to my YouTube page will win the show. Rupees 200 Paytm. Let's start. Okay. The first question on this planet is yes. Welcome to Clinical Pediatrics by Dr. Okay, what is the question? My first question is, listen to me very carefully. My first, listen to the question, okay? Don't jump with the answers first. The first question is that of course, we can see this patient has more than 5 fingers, which I know is known as polydactyly. That is not the question, okay? The question over here is, Madhuri Gupta, I'll tell you, dear, let's finish this quiz. So the first question over here is, which type of polydactyly is the least common type? That is the first difficult question of this class. Can you please answer in the comment section? I'll repeat again. This patient in the video, I can see he's having polydactyly. Polydactyly is nothing but more than 5 fingers. I know that. Everyone knows that. Everyone is answering also. But that's not the quiz question. The quiz question is, which type of polydactyly is the least common? You have time. You have 10 seconds. Okay, Shubham says type 3. Cute. Any other? any other person with some amazing answers? The beautiful answer for this question, okay, type 3, Panola says, Mansi Panola, Suman. Okay, there are 3 types of polydactyly, number 1. So I assume we don't know that, so no problem. Grace says, I don't know. Fair enough, no problem. So more than 6 fingers, the extra 6th finger could be on my thumb side. That is known as pre-axial polydactyly. That is the least common. This was the MCQ, but no one could able to answer, so no problem. It's a knowledge gaining session. Ritik Roshan's side extra finger is known as pre-axial polydactyly, is the least common. Post-axial is the extra finger on the ulnar side, and the central means extra finger on the central side. Can we have a beautiful picture? This is such a beautiful picture, guys. This is pre-axial polydactyly. Ritik Roshan's side is the least common. One more picture. This one, bro. See this. Can we see that the little finger side extra 6th finger is the post-axial, that is post-axial polydactyly. And again, can we beautifully appreciate this knowledge? Central polydactyly. This question no one could able to answer, so this part is done. Dr. Rajkumar says don't know. No problem. क्या ये अच्छा करण कह रहा है अगर पता होता तो गेस नहीं करता ओके दैट्स राइट परफेक्ट सो दिस क्वेश्चन हैज गॉन नो वन विन द क्विज ओके नो प्रॉब्लम नेक्स्ट क्वेश्चन प्लीज okay the beautiful question on this planet is this is the picture. What is your best diagnosis? Your time starts now. What do you think? देखो टफ क्वेश्चन डैडी ने टफ क्वेश्चन पूछे आज टुडे डैडी इज आस्किंग टफ क्वेश्चंस आई डोंट नो आई होप एवरीवन समवन विंस 200 पेटीएम हाँ जी दिस इज द फर्स्ट सेकंड क्वेश्चन ऑफ दिस क्विज कॉन्टेस्ट so let's see who has the best answer. This is the picture. What's your best answer? Single beautiful answer. You have 5 seconds to answer this question. 5 4 1 3 और 2 में खा गया okay. I need to know the answer. Priya Gupta says absent clavicle. That's right. But where do you see? Like, I think किसी एक ने आंसर किया. Karishma, okay. Yeah. Yeah. अब मैं क्या करूँ इसका? चलो. Karishma says the answer cleidocranial diatos. Your spelling is wrong. I'm sorry. I think Osama Sheikh has the right answer. The patient who has a absent clavicle. If I have absent clavicles, I can touch my, kind of bones together. That is known as cleidocranial cyanostosis, and the answer has been correctly given by Osama Sheikh. So that is 1 point for Osama Sheikh. 1 star we have given to Osama. Next question. This also same cleidocranial dysostosis, okay, absent clavicle. So 3 questions left. कौन सा पूछो I want to ask tough question. Easy question I don't want to ask. Okay. Yes. This is the question number 3. The question number 3. This is again a DM pediatrics question. This is the picture. The patient is in front of you. What is the best answer? What do you think? Shubham, Grace, okay, Sushmita Mondal, Orion, okay, we have a nice name, the Stholic Traveler Vinay. Oh, chakkar aa gaya sun ke. Hanji. Question number 3, this is the picture. What's your best answer? I'm sorry, today the quiz contest is really very tough. Osama is winning the show right now. This is the question number 3. It's a DM pediatrics question. This patient who has a kind of a anti-mongoloid slant where you have a downward deviation of the eyeballs. The patient have fat in the fingertips. Fat in the fingertips. And there is eversion. There is eversion of the lower eyelid. What is this? Okay. करण कह रहा है टाइपिंग की फास्टिंग स्पीड इंक्रीज करनी होगी. Okay. Okay, Osama says William, no. Congenital syphilis, no. Okay, the answer is Kabuki syndrome. The answer is Kabuki syndrome is a neat super speciality question. Kabuki syndrome, number one, the patient will have a prominent fingertip pads. The fingertip, the pads, the fingertip pad. Okay, I'll repeat again. This is the question number 3. The fingertips basically, they have what? They have a prominent fingertips, number one. Number two, the patient will have a long palpebral fissure, means kind of a, उसको बोलते हैं लंबी लंबी आंखें. Short palpebral fissure means small eyes. You can see in fetal alcohol where fetal alcohol syndrome. Long palpebral fissure is seen in Kabuki syndrome. And third point is, bro, that the patient will have a eversion of the lateral portion of the lower eyelid. Lower eyelid lateral portion eversion, bahar ki taraf utha hota hai, kind of everted. This is again a beautiful answer, Kabuki syndrome. Who told this beautiful answer? No one told. Perfect. 2 questions left, then this class is over. Which one should I ask? Which one should I ask? Which one should I ask? I want to ask a difficult question. Easy question is very kind of okay. Yeah. Question number 4. For the bone age estimation, for 12 to 14 year of child, which is the best X-ray available? Today I have made the question paper a little tough, okay? So don't mind, don't lose your heart. Any of these topics will be dealt in future. Everything is hard. No, grace is fine. So question number 4, for the bone age, for example, like I don't know the patients, like one patient has come to me 12 to 14 year, to confirm whether the patient is not lying, the family is not lying, I have to go to the forensic team and I have to get his bone age, चेक करने के लिए कि इसकी जितनी बोन में हड्डियां होंगी उतनी उसकी उम्र है. अकॉर्डिंग टू द बोन एज आई कैन से द पेशेंट्स एज बिकॉज आई एम अ फोरेंसिक एक्सपर्ट. So by looking at the patient's bone, the X-ray, I will count the number of bones and I can kind of say the patient's age. I'm telling you in a very rough word. Which X-ray will be better here? Okay, who told? Someone had told the right answer. Okay. I think Karan has told. Okay. Yes. Karan Bikram Singh. Karan मैंने बोला ना एक सेकंड. Knee joint. Karan also has not told the right answer. 1 second. Who has told? No one has told the right answer. Elbow and hip. Yeah. Karan. Dr. Karan Bikram Singh. Yes. Elbow and hip. According to my YouTube page, अगर एक when a patient is around 12 to 14 years old and if I feel the patient is lying about his age or the family is lying about his age, then I will get an X-ray done to look for the ossification centers and all that, and for that elbow and hip will be the right answer. So now in our quiz contest, Osama is winning the show and Karan Bikram Singh is winning the show. Last question number 5 is already what you called 9:44. My mom will shout. Okay, last question, then this class is over. Let's see. And now this question will be only like this question were kind of a okay. Now this question, Osama and Karan, I'll be I'll be checking your answers. Either Osama will win or Karan will win. That's it. So let's have the question. What should I ask you? What is a which tough question should I ask you? Which tough question should I ask you? Okay. Okay. Now, okay. In the last question is, in the sequence of changes in puberty, in the sequence on changes in puberty, which is the last sign of change in the puberty we see in a case of boys? Like for example, the first sign of changes in sequence of changes in puberty, the testes will enlarge, then penis will enlarge, then pubic hairs will come, like that, no? So what is the last sign of change in puberty? You will see. I'm gonna check Dr. Osama's and Dr. Karan Bikram Singh answer. Let's see. Okay, okay. Priya Gupta says that what do you called? Osama, शुक्र है तूने delete कर दिया अपना आंसर, वरना तो सुनता मेरे से. Priya Gupta says pubic hair is the last sign of changes in puberty in boy. Okay, that's a wrong answer. Ritu Satna, pubic hair. Okay, anyone? You have 5 seconds. It's 9:46. घर जाओ, हो गया. Hair growth extends to inner thigh. Okay. खाना बनाए? Shubham says pubic hairs. No. So that's right. Hair growth. Okay. Okay. I'm sorry. So everyone, like, now the answer is, in the boys, first we have the testis enlargement, then the penis, then we have the pubic hairs, then we have the growth spurt, then we have the axillary hair, and then we have the facial hair. The last sign of the puberty will be the facial hair. I gave the examples that first is testis, second is penis, third is pubic, which is the last one in the full hierarchy. You have the growth spurt, then the hair will come in the axilla, then the facial hair will come. Okay, okay, Bhavna. Okay, okay. Everyone says pubic hair, but the last will be the facial hair. So again, last question again, because still we don't have the winner. Still there is a tie between Osama and what you call Apna, not Shubham, Karan Bikram Singh. 200 पेटीएम आई विल डू, या तो 100 रुपये बांट लो आपस में दोनों भाई, या फिर एक क्वेश्चन पूछ लेते हैं. ओके, आई वांट टू आस्क अ टफ क्वेश्चन. ओके, लेट मी आस्क अ इजी क्वेश्चन. ओके, easy. Yeah, this is the easiest question on this planet. I'll be taking Osama's and Karan question. What is the instrument? That's it. It's a very easy question. हाँ जी, easy question. ठीक है, अब नहीं पूछ रहा टफ. शुभम कह रहे हैं वॉइस. विच वॉइस? आवाज़ अच्छी नहीं है मेरी ब्रो. Sumant Murthy. Okay. Last question. What is this? Identify. Maybe Osama is right or Karan. Anyone can answer, but Osama and Karan may say we have to take the one winner. Okay. Okay. Anyone? Osama, what's your answer? Karan, Sushmita, Ritu, Grace, Osama. Osama has told first, and Virendra Singh says B. Okay. Karan ने आंसर ही नहीं किया. Karan has not answered this one. Osama has answered the right. Yes, brother, you're very, very right. This is nothing but orchidometer to know the testicular volume. हाँ, exactly. So Karan, yeah, but you answered little late. This is nothing but known as orchidometer to know the testicular volume. Basically, in a case of SMR staging, sexual maturity rating staging, we use something known as Tanner's chart. In that Tanner's chart, we check the male patient's testicular volume by comparing it with these small pebbles kind of a thing, and that is orchidometer. Perfect. So can we please say a good congratulations to Dr. Osama, everyone. Dr. Osama is one of our very dear students. Even in the beginning, he used to answer very less, but today he is a rock star. Can we please congratulate Dr. Osama? He wins rupees 200 Paytm, and luckily I have your WhatsApp number, and we will do the needful. Thank you so much, everyone, for this beautiful participation. And today is what? So one small notification to everyone. आज कौन सा वार है? मेरा उसमें चल नहीं रहा. एक second, bro. Yes, today is 12th of October. Today is Wednesday. So now we'll have a class directly on the next Monday. We'll have directly the class on next Monday. It's a beautiful week today because tomorrow is Karwa Chauth, so I'll not have a class. I'm not keeping fast, but we will not have the class. And then I'm going Kasoli with my friends. Then also will not have a class. The next beautiful, amazing class will be on the Monday. Yes, Dr. Osama, I'll share the pictures. Perfect. Susmita Mondal, yes. Priya Gupta, Alfaz Menon, Mansi Panola, Orion Pandey, Guddu, yes. Perfect. Thank you everyone for this beautiful participation. And Dr. Osama, would you like to share any advice Whenever we have a winner, we always ask the winner's advice that how did you win, bro? Were you knowing the questions before? We have a lot of students, you know, some people says partiality, we have a partiality. Osama already knew the answers. ऐसे लोग पंगे करते हैं. Yeah. Alfaz, today I would like you to say some good शायरी, bro. तेरे पास है तो मुझे बता, bro. ले भेज इधर, हम उसको शेयर करेंगे. You have 30 seconds more. It's 9:50. The class is too much now. I have to go. Yeah. Okay. Last bar. Last. Okay. No problem, Karan. Uh, You are doing good. So, Dr. Osama, would you like to share any nice advice? Would you like to share with our beautiful people? We have 100 students who are live online. Great. Divyashri, Madhumi. Okay, perfect. Osama has one very beautiful thing to say is that consistency is the key. That's very well put. Consistency is the key, guys. That's very, very important. I want you guys to study nicely and be consistent. Religiously follow pediatrics by Dr. Anand classes. If you want to get a rank one or a distinction, maybe a PhD, you never know. Just enjoy the show and that's it. Thank you so much, everyone. Yes, yes, yes. कहानियाँ खत्म होती है, टाइम खत्म हो चुका है. अल्फाज एंड ओसामा, take care. Bye. See you on WhatsApp, on our WhatsApp status and Instagram status. And have a wonderful week ahead. God bless you. And bye. Bye. Bye.